Hey everyone, and welcome to This Explainer. Today, we're diving into a really powerful topic, how unresolved trauma acts as this unseen force, basically fueling substance use. We're going to be looking at this through the fascinating and honestly deeply important framework from iRelyRecovery. I'm so glad you're here with us because we are unpacking something that impacts literally millions of people, yet it's kind of completely misunderstood in our everyday conversations about mental health.
So let's kick things off with a pretty massive question. One that completely shifts how we view substance use disorder. What if a significant part of an addiction struggle actually stems from unprocessed grief and loss, just hiding right beneath the surface? You know, for so many people who feel trapped in a cycle they just don't understand, the addiction isn't only about a chemical dependency. It's actually about trying to survive this overwhelming sense of emptiness and profound emotional pain.
Section 1. The Unseen Force, Emotional Roots.
Okay, first things first, we really need to completely redefine what we think we know about grief. It isn't just about losing a loved one. Grief is about any significant change that creates a persistent pain or a deep void in your life. It could be the devastating end of a long-term relationship, losing a job that gave you a core sense of purpose, a sudden and maybe frightening decline in health, or even losing your own identity and cherished dreams. And what makes these non-death losses so incredibly hard is that society doesn't usually offer formal rituals for them. There's no funeral or extended time off to help us process a lost dream, right? So it leaves people carrying that immense emotional weight entirely on their own.
And to put this into perspective, the scale of this impact is massive. Statistically speaking, each death or major catastrophic loss directly affects an average of 5 individuals. Think about that. That creates a huge ripple effect of pain across families, friend groups, and entire communities. If that profound pain is prolonged and the intensity doesn't lessen over time, it leaves those individuals highly vulnerable to addiction. They are just desperately searching for any possible way to cope with their new, altered reality. Moving on to Section 2, the dangerous two-way street, grief and addiction. You know, our brains are biologically wired to protect us through that familiar fight, flight, or freeze response. But here's the catch. When trauma or immense grief isn't properly processed, that emotional pain essentially gets trapped. It literally lingers in your nervous system, keeping your body in this constant, exhausting state of hyperarousal. And when that physical and emotional distress just gets way too heavy to carry, well, drugs or alcohol are often used as a temporary escape hatch. But numbing those painful memories is just a quick fix. It inevitably leads to a vicious, repeating cycle where your baseline of pain actually just grows stronger once the substance wears off. Just to give you an idea of how incredibly common this cycle really is, current statistics show that 7.7 million U.S. adults live with co-occurring PTSD and substance use disorder. 7.7 million. That highlights a massive critical overlap between trauma and addiction. It's a flashing red signal telling us we absolutely cannot look at substance use in a vacuum. It is intrinsically, undeniably linked to our overall mental and emotional health.
So what we're looking at is a seriously dangerous two-way street. On one side, unprocessed grief, that intense sadness, anger, or despair, triggers substance use as a person reaches for any kind of temporary relief from the suffering. But on the flip side, the addiction itself destroys relationships. It causes the loss of trust, jobs, financial stability, and physical health. So the loss fuels the addiction, and the addiction fuels the loss. It's like being caught in a whirlpool that is incredibly difficult to escape without some sort of targeted intervention.
Section 3. Warning Signs, Spotting the Problem.
Now, if you are the one struggling right now, honest self-awareness is your absolute best tool. If you find yourself turning to substances more frequently or in larger amounts right after a major life change, you really need to pause. Ask yourself, are you using drugs or alcohol specifically to push away intrusive memories or to numb a sudden wave of sadness? If your consumption clearly spikes right when your grief feels overwhelming, you are likely engaging in avoidance coping. You're self-medicating. You're trying to push the pain away, but left unaddressed, trust me, that emotional debt will only resurface stronger.
And for families watching, you've got to keep an eye out for these behavioral shifts in your loved ones. Look out for increased isolation, really unusual emotional reactivity, or just a sudden decline in their daily responsibilities and personal hygiene. And actually, it's incredibly important to note that in cases of overdose death bereavement, surviving family members also battle this really complex guilt, shame, and societal stigma. Often, this profound shame traps families in silence. It isolates them and prevents them from seeking the very help they desperately need.
Families absolutely need structured support too, because navigating a loved one's grief-fueled addiction, it's a profoundly difficult journey.
All right, let's look at Section 4, Traditional Treatment, Why It Fails. Here's the thing. If a treatment program is only looking at the surface, meaning they're simply trying to cut away the visible symptom of substance use without treating that deep, underlying emotional root system, it leaves the individual highly exposed. Generic treatments that just ignore unresolved trauma mean that the risk of relapse, especially when a new wave of grief strikes, remains incredibly high. The familiar emotional pain just resurfaces, driving the person straight back to those harmful coping mechanisms. Why? Because the roots of the problem were never actually pulled.
Part 1. The Path to Healing. Integrated Treatment.
So building a solid foundation for actual, lasting wellness, it takes a carefully structured, step-by-step approach. It has to start with physical safety through a medically supervised detox to stabilize the body. Then, transitioning into inpatient recovery gives them a secure, trigger-free environment. And it's only when that safe, physiological foundation is fully locked in that the individual can truly engage in dual diagnosis treatment. That's when they can do the heavy lifting of deep emotional processing with grief-informed therapies.
This is where specific, evidence-based trauma therapies come into play. Things like EMDR, which actually helps the brain reprocess traumatic memories so they lose that intense emotional charge. Or somatic experiencing, which addresses the physical trauma that gets stored in the body's nervous system. By utilizing these, iRely treats co-occurring conditions like PTSD and addiction simultaneously. They don't just ignore one to treat the other. This integrated approach ensures that patients can bravely move right through their grieving process in a completely safe space, rather than just trying to tiptoe around it.
Ultimately, a huge piece of this journey is about empowerment. It's about finding the light again. The whole goal is to empower individuals to build long-term resilience. We want to replace that avoidance coping with healthy, life-affirming mechanisms. By integrating mindfulness practices, regular exercise, creative expression through art or writing, and fostering truly meaningful, transparent connections with other people, individuals aren't just surviving without substances. They're actively building a life where they can find genuine joy and sustained peace in their sobriety, and that's a game changer.
As we wrap up today's explainer, I really want to leave you with this one final thought. True, lasting recovery is absolutely possible. It really is. But it requires courageously addressing those unseen forces within. It means looking at the whole person, not just the symptom. So what if breaking free from addiction actually means finally allowing yourself to process your grief? Are you ready to heal the whole picture? Thank you so much for joining me today to explore this vital framework. Keep learning, keep seeking understanding, and I'll catch you on the next explainer.